I'm talking to Amir Gilboa. He's the Chief Digital Officer of Healthcare Israel, and he gave a fantastic presentation about all the digitalization of the Israeli healthcare system. We're going to start at the top and then slowly break down. Amir, thank you very much for this presentation. The view which we get from the Netherlands is that the Israeli system has had healthcare records for 25 years. All the systems are connected in some kind of a beautiful network, and everybody has access to all the patient records everywhere. That is the basic idea, and on top of that, lots of digital functions have been created. Let's start with that. The whole top layer, which connects everything together, how is that called?
The HAE, the Health Information Exchange, is connected all the EMR and EHR that we used in the HMOs and also in the hospitals, and help the physician to get the most relevant data in each point of care. This is the idea.
This is the idea. Okay, and then you had said a bunch of words. So you had the healthcare exchange. Yeah. That's one thing. That's the top layer. Then you have all the individual system, the HMO, and the EMR is the HMO systems, and you have the hospital systems, and you have all kinds of private care. Yes. And is it one gigantic central database, or is it a network where all the information is stored and people can find it?
Great question. It's we decided in Israel to not make it like a central database because many of reasons. Yeah. It worked like, you have a copy of your database in your site. Like if you are in HMO, you have your own EMR, and beside you have a separate database. You have the ability to control about the transformation of data, and it's a separate system. The idea is when the physician asks for data and when the patient comes for the physician, he type the identification details, and then the system crawling all the network and get the data in real time.
So it's like a Google search over all the different databases which are existing in the Israeli system. Does that really work? If I type in your name, do I get a rich set which makes any sense?
Yes, it's took a long time, many of years, but now physicians say we cannot work without it. Okay. And it's take a couple of seconds, and then you get all the data in real time. Of course.
And it looks a little bit reasonable, or is it a whole bunch of data from which is copied here and copied there, or is it a useful, integrated, nicely looked data set?
Yes, we already have challenges with that, because in many organizations they classify the codes and all this data different. In some cases, not all, but we try to improve it. Yeah. And we have the headlines, and in the bottom we have all the data. We're trying to divide it to headlines that make sense. But we have to improve all this, and we have a transformation project in the Ministry of Health
to make it better. Yeah. Always to make it better. That's the Israeli way. Then if I'm inside an HMO, I have all the HMO's data of a patient. Is that much more richer? Is there much more information in the HMO system compared to the central system?
We don't have the central database in the national system. Yeah. It's just the access to all the EMR systems. Okay. And it's you can each HMOs can choose what the details to share.
That's what I'm saying. What is on the national level available? What is on the national network exchange, healthcare exchange? What is available?
So you have, of course, the demographic data, the medical history, the allergies, the lab tests, the imaging, the medicine, all this stuff.
All the objective information.
And yes, and a data like psychological or psychiatric data, we're not sure.
Yeah, okay. And also the notes of the physicians, which he basically keeps for himself or inside the HMO system. Do you see that, or is that dependent on?
No, the notes is not a formal record, and all the things it's a not formal record we don't share.
Okay, good. So that's interesting to see that it is complicated. It's fragmented, it's decentralized, it's a search engine, it's copying of information, etc. Then about the other big initiatives, you said about 5 big initiatives in the digital healthcare system of the Israel. What are the other systems, like telemedicine?
Yeah, so we have many telemedicine systems that each HMO hospital can choose the way to use them. The big issue was that in the past, that hospital wants to use telemedicine encounter, they cannot get money for this.
Yes. Okay.
And
so it's mostly actually that's the big step forward.
And in 2020, I think,
With COVID.
with COVID, we have or 19. I don't really remember, but in this years we have a new law that that's saying that you can charge on telemedicine encounter, and then it
flew. Yeah. And is the same price for a physical visit or an online visit?
I think not, but I'm not familiar with all the numbers.
No, but slightly different, maybe a little bit less.
Yes.
Okay.
Yes.
And now I saw it went from 20% to 33%, and is it growing rapidly?
Yes, it continued growing. The COVID make the difference all over the world, and of course here in Israel. And physician, they don't want to use the internet. They're starting using it because they don't have a choice.
Yes.
And then for now they say, hey, it's very cool. We want to continue use it.
So that is the same in the Netherlands. I mean, they had to use it, and then they go, "Oh, we hate it." But then nowadays, they basically think it's necessary.
Yeah, I think yes, it's saved time.
Yeah.
In many cases, when you go to, for example, for specialist, and for the first visit, and he told you, hey, you don't have to see me now. You have to go to the imaging or some other tests. And if we can save this time and not get the patient to the hospital, and he just saying in a telemedicine meeting, it saves time for the patient and for the physician.
Yeah. Of course, we'd love to have some figures about are these meetings normally shorter? Do you get it quicker as an appointment and those kinds of things? Is that information already available, or will that come in due time?
I don't have this information, but we already see that it grows.
Okay, wonderful. Then, of course, we are extremely curious about the big data. You have these big data sets anonymized, no DNA, but which companies and which institutions and scientists describe how we get access to this beautiful big data database of all the patient records and all the information anonymized.
So we don't have all the patients. We have, of course, when I say before, we don't store the central database in the national level, but in the Ministry of Health, we have a national initiative for big data sharing, and of course, you have to ask for the research, and then they have a committee that decide what kind of data you can access to. But we also have initiatives in the hospitals, in the HMOs itself, and they also share data and work closely with the industry. They want to get the data and to make.
And they're allowed to.
Yeah, they are allowed to. We have a secondary use law for this, exactly for this manner, to drive this initiative ahead.
Yeah, and the HMOs can ask a price for sharing their data?
Of course, and they do it.
And they do it. Do they normally work with companies, and do they invest in them and get shares? How do they work with science? Is it for free for science? How does it work?
We have many kind of models, but it's all business. And
it's all business.
Yeah, it's all business. Everyone want to make money, and everyone want to improve the patient care in the hospitals, and of course in the academy they want to publish articles.
Yes.
So all of this together, when we work in the ecosystem, this is a win-win situation, and of course the negotiation over the conditions.
Do I have a feeling, if I want to have 10,000 patients, and I want to have who have a particular disease and that kind of stuff, do I have to pay hundreds of thousands of euros to get access to the data? 10,000? Does it take a day? Does it take a week? Does it take a month? Does it take a year? Do ethics committees get involved? Is it really complicated, or is it a streamlined process?
It's a very different between each organization. Some organization is ask you to come to their facilities and to make the research there. Some of them ask you for working together with the physicians that help you in the medical side. And there are many kind of business models together, but it could start. I don't know. I don't want to say something that wrong, but there are many kind of collaboration between them, and it's depend what package you get, and
but it's all individualized, not standardized, depending on everything. So it's complicated. So
Yes,
it doesn't. It's not like, hey, I can go to the website, say I want so much records. Isn't this price ready? No, it's complicated, just like every other country.
As I said before, we have the Israeli profile for FHIR, and then FHIR, FHIR, it's a new protocol for sharing data between healthcare system. It's a national standards. It's new, and for each country they have some adjustments. And the Ministry of Health working on that. And in the day we started, and there are already projects that working with these standards, and it is very easy to share data via these standards. So this is the idea, to make this process very easy.
Okay. Wonderful. If people want to know more about the initiative, the digital healthcare in Israel, where should they go?
So they can start looking in the Ministry of Health website, Healthcare Israel, the LinkedIn profile. Startup Nation Center is a good place to looking for data. And of course, you're very welcome to contact me for any additional information.
Yeah, and I'll put the email address underneath that. Thank you very much for sharing the beginnings of a very complicated, fascinating trip to the Israeli digital healthcare system.
Thank you.